A lot of times I'm seeing, girls around 15 or 16 just to kind of get established, with their care with me. They don't necessarily need to get an exam, but then they have someone to meet with yearly and talk about period regulation and all of that.
Although we don't do pap smears till the age of 21, I tell women that if they have daughters that are having any problems with their periods, or if they think that they might become sexually active, that they should establish care with a GYN provider.
Thought of going to a gynecologist for a young girl is very scary. A lot of the younger girls that come to our visits is a lot of just talking. Let's talk about your health history. Let's talk about how your periods are doing, and again, we try to have one-on-one talks with maybe parents out of the room as long as the kids are okay with that, to talk about some sexual health questions that they might have. If an exam has to be done, believe me, we are very aware that it's uncomfortable. We try to do everything we can to lessen their anxiety and their discomfort.
I also tell patients, don't worry, if you come and you're 14 or 15, I'm not doing a pelvic exam unless you need it for some reason or unless the patient has any concerns.
Advice I would have for females going for their first OB-GYN appointment is don't be afraid. If you're scared of any part of the appointment, make sure you let your provider know that.
We're not that scary. I think everyone's fairly nervous. Most of the time what I hear from people is, oh, that wasn't really that bad. So I think relax, be honest with your doctor, about your concerns or fears.